Hi, I'm Dr. Rebecca Walker from Stanford University School of Medicine, and today we'll be discussing a case of shortness of breath.
Good.
Ooh, hot dates.
No, I gotta give a check at this symphony fundraiser thing.
Lifestyles of the rich and famous, baby.
Look what the patient fairy brought you.
No.
Mrs. Hawks, 44, fever, cough times 3 days.
I'm telling 10 patients already.
Just waiting for a chest film. If it comes back clear, just write a little script, send her home, easy dispo.
Okay, good. It's probably just a flu. Give it to Pratt. He'll hate it.
Done.
Okay, so this sounds like a pretty common complaint of patients who come to the emergency department, fever, cough. What questions do we want to ask the patient to kind of differentiate how bad the fever and cough are, any patient that comes in with a cough? And then the doctor also seems like he's wanting to send the patient home after a few things. How does he make that decision so quickly?
Pneumonia. The right lobe is completely socked in.
So much for an easy dispo. Did you run labs?
White count was 27,000 with the left shift. Gram-negative rods in the sputum.
Call ICU.
Oh, so it sounds like she has pneumonia. What are the different ways to diagnose pneumonia? Do patients always need a chest x-ray? Are there physical exam findings that are important in a patient with pneumonia? And what else would be in the differential diagnosis if you think that a patient has pneumonia possibly?
Sats are only 85 on 2 liters.
Okay, crank her up to 5 liters nasal cannula, get a gram of cefotaxime IV, and 500 of Biax.
This is Dr. Lewis.
Never had flu this bad.
She's coughing a lot. Do you guys have any cough medicine?
We're giving her all the medicine we can right now. I need to talk to your mom for a minute, okay?
Hey, you guys want a soda?
Go on.
So it sounded like the doctor was starting some treatment for the patient's pneumonia. I think she mentioned some Biaxin and cefotaxime, and her son asked for cough medicine. So what is the treatment for pneumonia exactly?
I just need some sleep. You know, I never should have called 911.
Well, I'm glad he did. This type of pneumonia is very dangerous.
My kids have homework. They need dinner. Write me a prescription. I'm gonna get it filled on the way home.
Well, at least it looks like the patient's feeling better. How do we assess whether the patient is better and which patients need to be admitted to the hospital for pneumonia or if they're able to go home?
What's up?
Sats down to 83.
Take slow breaths.
Mom?
Sats down to 78.
Crank up the O2. Get them out of here.
Come on.
So it looks like this patient's oxygen status is really deteriorating. How often do you need to check the oxygen saturation for someone who is hypoxic? And if they are hypoxic, like this, they mentioned that she was about 78%. How do you decide how you adjust their oxygen level or the supplemental oxygen that you can give them?
Come on.
She's not moving in the air.
Bagger, get 20 of Tominate, 100 of Suck, set up for an intubation. You called him?
Aunt's in Detroit. The brother's here. I was just trying to help.
You can help by learning to listen when the patient asks you not to do something.
So it looks like this patient is about to be intubated. Do you think that she should be intubated? And if so, why? What can we learn from this case in general?